have Ebola needs to be top of mind right now for healthcare providers throughout the country. At CDC, we do quite a bit to support healthcare workers in addressing and assessing patients. We've provided detailed information that should be available to every frontline healthcare worker about how to address a patient who may have Ebola. Anyone with fever should be asked if they have been in West Africa, specifically Guinea, Sierra Leone, and Liberia, in the past 21 days, and if so, rapidly isolated, fully assessed, and if appropriate, tested for Ebola. We provide something called health alert networks, which reach hundreds of thousands of healthcare workers. We do webinars. We reach out to professional associations, hospitals, emergency department associations, medical associations, and many others, so that we can ensure that the available information is up to date and useful. Right now, the bottom line of what we're talking about today is that we're stepping up protection for people coming into this country and for Americans related to travel. We will continuously look at ways that we can increase the safety of Americans, and we do that at many different levels. We do that in Dallas, where officials there are working intensively to monitor every person who might have had contact with the index patient to ensure that if they do develop fever, they're immediately isolated and the chain of transmission can be broken. We do that in our healthcare system with the kind of outreach I've described, so that patients will be rapidly diagnosed and, if found to have Ebola, rapidly and effectively isolated. We do that at the source, understanding that until this outbreak is over in West Africa, whatever we do can't get the risk to zero here in the interconnected world that we live in today. And we do that through entry and travel programs, including the efforts that we undertake in West Africa, and some that will be described in more detail later in this briefing. I think before turning it over to Deputy Secretary Alejandro Mayorkas from the Department of Homeland Security, I would like to emphasize the basic principles we use when looking at interventions. We continuously evaluate ways to better protect Americans. Protecting Americans is our #1 priority. Second, we make sure that whatever we do is something that works, that we evaluate, and that we can think of ways to continuously improve. Third, we recognize that whatever we do, until the outbreak is over in West Africa, we can't get the risk to zero in this country. That's why we continue to surge the CDC response in West Africa and the whole of government U.S. response in West Africa, and in fact the international response, where we're seeing hundreds of healthcare workers, hundreds of millions of dollars, and intensive effort deployed in the 3 countries most heavily affected. And finally, as we say in healthcare, above all, do no harm. We have to ensure that whatever we do doesn't unintentionally increase the risk that we will be at risk. Just to remind us of what happened a decade ago in the SARS outbreak. The SARS outbreak cost the world more than $40 billion, but it wasn't to control the outbreak. Those were costs from unnecessary and ineffective travel restrictions and trade changes that could have been avoided. Well, what we want to do is ensure that we don't undermine our ability to stop the outbreak at its source and unintentionally increase our risk here. So to outline some of the new measures being taken and review some of the measures that are already taken, I'll turn it over now to Deputy Secretary Mayorkas.
Thank you very much, Dr. Frieden. The Department of Homeland Security is focused on protecting the air traveling public and is taking steps to ensure that passengers with communicable diseases like Ebola are screened, isolated, and quickly and safely referred to medical personnel. We have implemented a range of measures to ensure a layered approach. To date, the existing measures in place include issuing do not board orders to airlines if CDC and the Department of State determine a passenger is a risk to the traveling public. 2, providing information and guidance about Ebola to the airlines. 3, posting notices at airports to raise awareness about Ebola. And 4th, providing a health notice, commonly referred to as a tear sheet, to travelers entering the United States that have traveled from or transited through the affected countries, with information and instructions should there be concern of possible infection. We have announced today enhanced measures. Specifically, the enhanced screening will consist of targeted questions, temperature checks, and collection of contact information of travelers from the 3 affected countries entering the United States at 5 airports: JFK, Newark, Dulles, Chicago O'Hare, and Atlanta. Customs and Border Protection officers, by way of background, the CBP officers observe all passengers for overt signs of illnesses through visual observation and questioning as appropriate for those entering the United States at all ports of entry. In addition, moving forward, all travelers arriving to the 5 airports.
They're a private organization just like the Federal Reserve.
The CDC.
That's a question. The CDC is just like the Federal Reserve. It's a private organization. Why does the CDC own 70 patents of Ebola? That means 70 variations. Along with the World Health, or not the World Health Organization, the National Health Organization has the patent to make with Bill Gates, a vaccine, just like Monsanto.
This is a question that came up, David, weeks ago now, because of course the FDA blocked several Ebola treatments before this outbreak even began, and then we've got reports that the CDC has all these patents on different strains of Ebola. So is the profit motive there in creating the panic, then creating the vaccine with these patents? We'll get your answer after the break. Going to go some more of your
The reason I'm
calls.
calling today is I've not heard any questions or anything brought up. One of your callers just called in and he never got an answer. Looking at the article, the government of the U.S., as represented by the Department of Health and Human Services, Center of Disease Control, the patent says the invention provides the isolated human Ebola viruses denoted as Ebola deposited with the Center of Disease Control in Atlanta, Georgia in 2007. There's a patent online and everybody's ignoring it. I've sent it and sent it. I've sent it to every news station, and I've not even heard InfoWars mention it.
What they will tell you is that their patent is on the handling of it and the growing of it and that sort of thing. But I'm very troubled by the fact that we have the CDC, an organization like the Federal Reserve, in so much control of what's happening here. And I'm not very happy with the misinformation that has been coming out of there and the examples that they've been giving to people. I firmly believe that they're going to allow this to grow. They're looking at the Bill and Melinda Gates Foundation and Burroughs Wellcome are working on changing ZMAP so they can, it's going to take them longer to do it, but they're going to mass produce it in a different way after, I think, it has started to spread amongst our soldiers and in the United States.
You are watching the best.
Paul Joseph Watson in the hot seat for Alex Jones. Alex will be back tomorrow. We're going to have Anthony Gucciardi in studio in the next segment. But breaking news up on Infowars.com. We mentioned earlier the troops being sent into Liberia and Sierra Leone. U.S. troops would have direct contact with infected Ebola patients. Now we have a top story up on Infowars.com. Pentagon claims Ebola not a huge risk to troops in West Africa. The 4,000 service members being deployed to combat Ebola in West Africa will be, quote, kept safe from the virus, the Defense Department claimed, despite the fact that health officials have failed to contain Ebola, which is now spreading on multiple continents. During a Pentagon news conference today, U.S. Army General David Rodriguez, the commander of U.S. Africa Command, AFRICOM, said the military is using, quote, strict protocols to protect the troops and will implement careful reintegration
of the world that have malaria to take preventive medications which are highly effective at preventing malaria. What we would do in this situation is a clinical assessment and an exposure assessment. If appropriate, we would then hand that individual off to either the local healthcare system that might need to assess and isolate the individual and test them, and we would facilitate that, or to the local public health system, which would, if the person is actually a contact, take appropriate action to, at a minimum, ensure that their temperature is taken every day for 21 days after the last exposure. So just before taking questions, I would reiterate that what we're doing is stepping up protection. We will evaluate the new measures and start them on Saturday at JFK, and over the coming week at the 4 other airports I mentioned. We'll evaluate this experience. We're always looking for ways that we can better protect Americans. Thank you, and we'll start with questions in the room.
Dr. Frieden,
just wait for the mic. Thank you.
Dr. Frieden, there are some critics out there who are saying that even with these enhanced efforts, that people will fall through the seams, that it won't be enough. Will these efforts be enough to protect the country, to protect other people from Ebola?
What we're doing is putting in additional protection. We've been very clear that as long as Ebola continues to spread in Africa, we can't make the risk zero here. We wish we could. We wish there was some way that we could make it zero here. And I understand there have been calls to ban all travel to West Africa. The problem with that approach is that it makes it extremely difficult to respond to the outbreak. It makes it hard to get health workers in because they can't get out. If we make it harder to respond to the outbreak in West Africa, it will spread not only in those 3 countries, but to other parts of Africa, and will ultimately increase the risk here. That's why the concept of, above all, doing no harm is so important here. Next question in the room.
Hi, I'm wondering when else other times that such screening might have been conducted at airports, and if so, how effective is this actually at finding sick people?
We've looked at different screening methods at different times. The thermometers that are used are highly effective. They're FDA approved. They're approved for use in U.S. hospitals. They don't require touching the patient, and they give a reliable result. Deputy Secretary Mayorkas, is there anything more that you'd like to say about prior events?
I do not believe so, Dr. Frieden. Thank you.
Next question in the room.
Sabrina Sabrina, New York Times. What's the legal authority that the federal government has to hold American citizens if they need to be quarantined or something? And also, there have been some public health experts that said that basically it's kind of like looking for a needle in the haystack, and really the effect of what's happening today is sort of to calm the kind of public panic about Ebola, that that the risk, that the actual usefulness of catching somebody with it is pretty low, but that the real effect is to calm people down, basically.
I'll make a couple of points and then turn it over to Deputy Secretary Mayorkas. The first point is that the number of travelers is relatively small. We're talking about 150 per day. So it's not an effort that would be particularly disruptive to large numbers of people. We think it's manageable. And in terms of the legal authorities, both within the public health and within the border efforts, there are legal authorities. In public health, most fundamentally, there's a right to protect the public, and we can do that by isolating individuals who may be infectious and may be a risk to the public. Mr. Mayorkas?
Thank you, Dr. Frieden. I would just add